We are talking skincare for the ages this morning. Today we are focusing in on you ladies in your 30s. So here to give us some tips, Kim Whitaker from the Center PC. Thank you so much for joining us.
Thank you.
All right, well, let's start off talking about skincare in the 30s. Things are going to change as you get into your 30s. What things affect the skin?
This is where we start seeing that lifestyle accrue on our face.
Right.
Things that we've done in our 20s is going to appear on our skin in our 30s. Sun damage, so if we went to tanning beds. Spots are going to come out on the face. We're losing collagen and elastin at this time too, or starting to, because of UV damage. And so a little sagging may occur. We're going to see expression lines on the forehead, around the mouth, and around the eyes. And if you're an over-animator, you're going to see a little deeper lines.
Yay, that's great for some of us, right? Okay, now there are actually some things that you can do to help your skin when you're in your 30s. So what are some of the main tips?
Well, you want to continue with your regimen. You want to cleanse, tone, moisturize. You want to add an antioxidant, which is going to protect your skin from free radical damage, and an anti-aging product. You know, you want to continue with like Retin-A and up the dosage and the frequency.
Now, when you say anti-aging product, there are a billion out there. So what do ladies need to be looking for, and is it pertaining to each individual?
It is. It depends what your main concern is. If it's spots, then you're going to look for something that's going to lighten or brighten the skin.
Okay.
If you're looking to boost collagen and elastin, you want to look for something with vitamin C in it.
Okay.
For lines and wrinkles, Retin-A, you know, or retinol product is going to be the best. Plus, you want to do these chemical peels and microderms at least once a month.
Now, for anybody out there who's never had a chemical peel, what's the process going through, and how often? You said once a month?
Once a month. You know, you can go into an office and have one done. It's fairly quick. There's not really a lot of downtime associated with it unless you get a deeper peel. Plus, you can opt for dermal fillers or Botox. You know, that's going to take care of a lot of that, too.
So some good advice out there, ladies. Now, we did ask today on Facebook if any of you out there had some questions. Got some great responses for you. So we're going to kick it off. One of our viewers asked, how do you get rid of pimples on the nose? Happens all the time.
Well, you want to cleanse the area really well. And things like Retin-A, benzoyl peroxide, those are going to, the Retin-A is going to exfoliate the skin to keep those pimples from, you know, coming to the surface, drying them up, and then the benzoyl peroxide will dry them up.
Any reason why you just tend to get them more on the nose area?
You usually have more oil on the nose.
Okay. All right. Well, there you go. All right. Here's another question that a viewer had. How do you even out the skin tone so everything looks right?
Well, there's several options with that. Laser is a good option, depending on your skin type. Plus, you know, prescription brighteners or lighteners will help, like hydroquinone. That's a brightener that is going to even out the pigment in the skin.
Say there's somebody who's on a budget and they can't afford that. Is there something they can just do that'll help it?
You know, Retin-A is going to help take some of that off, but you need something that is going to brighten the skin at the same time. Okay,
all right, good deal. Now, here's another one we had, actually. Lady wrote in saying, I'm 35 and notice my skin is changing. What lotions should she be using now?
She should be using something that is going to stimulate the skin. You know, something with your vitamin C in it, your antioxidant, something that's going to hydrate also, because if she's getting drier and noticing finer lines, she's going to have to switch her moisturizer that she was using in her 20s. You know, something with CoQ10 even, those kinds of things. But, you know, really, if you can come and consult with somebody, that is your best bet, because they're going to be able to really analyze your skin and get you those products that you need and will work.
So again, personalizing everything to yourself and finding out what works for you.
Yep.
Kim, it's always such a great thing to see you. Appreciate all your wonderful advice.
Thank you.